Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about the differences between using urine mycotoxin tests and blood mycotoxin tests. I know this is highly controversial. I know this is just my opinion. I'm just offering you my thought process in regards to why I use my mycolab, which tests 13 mycotoxins in the blood. So, there are a number of labs that will test your mycotoxins through urine, and they ask you to do a challenge, and then you pee in a thing for 24 hours, and then they measure um, your mycotoxin load. It never felt right to me, ever. I thought to myself, well, why would you measure something that's a toxin in your body after you've excreted it and not when it's in your body? I never could understand that, which is one of the, and I used to use the urine mold test quite a bit early in my career, but they just didn't jive with the symptom presentation of the patient. And so I started to look at other options. I found my Myco lab, and I've been really, really happy with them. And I feel like they do a very good job of documenting mycotoxin illness. They measure both IgE and IgG antibodies in using the blood, and they measure 13 different mycotoxins. So mycotoxins are the molecules, the toxic molecules that are produced by the molds. And they are generally produced in nature as a defense mechanism. It's mold's defense mechanism, which is really interesting. I when I found that out, I thought, wow, that's pretty interesting. But we see this in animals, skunks, when when they want to be defended, they shoot out a bad smell. There are certain fish that will shoot out venom when they feel threatened. So this kind of phenomenon in nature is not unique. Venus flytraps will close when you touch the inside of them. They're very sensitive beings, or plants, beings, same thing. Being meaning anything alive. And I use my Myco lab, and oftentimes with a challenge, but sometimes not. If I suspect gliotoxin in the brain, I do not use a glutathione NAC challenge at all, because glutathione and NAC can make gliotoxin worse. So I don't use that. And otherwise, if I suspect that it's aspergillus or ochratoxin or aflatoxin, which are both on foods, aspergillus is really common, so is penicillium, then I will sometimes use glutathione and NAC for a 14-day challenge. I prefer the blood test because I think that when you measure a toxin in somebody, I think it's a more accurate measure than looking at their urine. Now, I know they do drug testing through urine. I know lots of things are looked at through urine. This is just my opinion, and you can take it or leave it. But I think that blood tests are far more accurate, and then you can repeat them every, say, 6 months, and you can see if the mycotoxin load has come down as a result of your treatment. And so I like the level of specificity in the MyMyco lab. So that is why I choose MyMyco, and it's $380. And the way that company works is we charge your card $380, and then we send you a test kit with a barcode, and then you put that barcode in the box, and you get your blood drawn, either after a challenge or not, and then send it off. And it usually takes about 3 weeks to get the test results back, and then I review it. I tell you, okay, this is correlated with this. Da, da, da. For example, zearalenone is an endocrine disruptor, so it disrupts hormone function. Ochratoxin and aflatoxin are often found in foods. There's lots of gliotoxin affects the brain. There's lots of little nuances about mycotoxins that can be very helpful if you know which organs they affect. So I hope that you found this information helpful, and I hope you have a wonderful day. Take care.